National Association of Sea Dogs, also known as the Pirate Confraternity, has brought critical healthcare support to Kukuaba village in Abuja through a free medical outreach. Organized by Zuma and Sahara Degs, the initiative served over 200 residents with consultations, lab tests, and vital check in a community lacking any nearby public healthcare facility. The outreach marked both the 91st birthday of founding member Professor Wole Soyinka and Dr. Joseph Oteri's 40 years in medical service. NAS leaders said they aim to expand services and are urging government action to establish a closer functional healthcare center in the community.
NAS on its own have been doing a lot of medical outreaches. In 1996, I did an outreach in Rivers State, right, while I was still in Port Harcourt. And after that, we'll be doing outreaches at every quarter when we go for our quarterly meetings. So this is just to show that since you were in charge of all those outreaches, let us celebrate you with an outreach. So this is what we've done. I didn't know when they were planning it. Most times, what we do, we support the downtrodden, right? People that couldn't afford some things are the ones we actually target. So if you look at most of these people here, some of them might not even have access to paracetamol if they go to a clinic. So we felt, okay, let us bring all the things they need. Normally, they start with the scoping mission where they find out what are the prevalent ailments in the community. Then they procure drugs to take care of those ailments. So they have a lot of human resources, doctors, nurses, and volunteers, plus laboratory people. So
just the start. We're going to come back here on a later date based off what we've seen today. Because this is just asking them to come for the basic checks, the basic medications, treating malaria, the sepsis, the basic things you see in an outpatient clinic. That's what we're doing here today. This is NAS. What we're doing here is, our central body is aware we're doing it. We have the capacity to even go beyond the numbers, if need be. Yes. For a start, we're attending to the basics. Free medical checks that would help us indicate whether you're hypertensive, diabetic, the sicklers that don't even know their status. They're always in the hospital. We have 2 cases that we've identified this morning that are sicklers. They're always in their local hospitals. They give them markings and all that without knowing that these guys are actually sicklers. We're also offering our lab interventions that will help us detect all these things. The basic investigations, the lab, the full blood count, the panels.
So we organize this outreach to honor both of them. We think that as a social advocacy organization, the best way to honor them is to come to the less privileged, the underserved, to make sure that we also offer some help to them. So essentially, we decided to come to Kukuaba village in Kubwa here to do this medical outreach.
1 year plus now. If I'm sick, I do go to all those big pharmacies. From DBA, if the sickness is much, I'll go to all this private hospital. So the general hospital is far from this place, very, very far. That is it. Some of them that they don't have a private, that they cannot go to private, they don't even have money. Sometimes they do go to pharmacy and just get, you can see that what they are sick for, they're supposed to spend maybe 40,000, 50,000. Due to say they don't have money, there's no primary health care here, they will just go and afford something of maybe 5,000, 3,000 to just take good care of themselves.